When I put my uniform on, I'm ready to help someone on the worst day of their life.
As a paramedic, it feels good when you can make a difference.
SA ambulance service.
It's an emergency. She's gasping for air.
Stay on the line. I'm organising help.
Every minute that goes by, a patient has less chance to live.
It's the ambulance here, mate.
It's got no air entry.
Decompress that chest.
As soon as we arrive, they just know they're in safe hands and that we're going to do everything we can to help them.
Hello.
Does that feel better? Yeah?
You walk in and see the fear and distress melt away.
Oh, you poor thing.
I wouldn't have guessed you were 104.
I genuinely think laughter is the best medicine.
Let's go. Teddy wants to go.
That's the way.
You're very brave.
To know that you bring someone that's very unwell to hospital and they get better. It's one of the best feelings in the world.
Look at that.
That is great.
You can't thank them enough.
I promise I'll look after you.
They're second to God, these people.
All right, well done.
Let's get you in the ambulance, eh?
I feel really proud to wear this uniform and I feel really proud to be a paramedic.
Charging.
On this episode of Paramedics,
Hands off. I'm safe. I'm shocking.
a trip to buy a newspaper ends in a terrifying cardiac arrest.
No pulse. No pulse.
Essentially, she is clinically dead.
A mother's worst nightmare as her teenage son slams into a light pole.
When I saw the vehicle, I started to panic. I just can't imagine life without my child. It just wouldn't be survivable.
And has a sickening football collision ruined this schoolgirl's most important night out.
No year 12 formals or anything.
Yes.
Oh, sorry. I was joking. Oh no, the poor thing.
SA ambulance service. Tell me exactly what's happened.
So a lady has walked in, an older lady. She flipped over. She has landed flat on her face. There's a lot of blood.
All right, so stay on the line. I'm organising help. I'll tell you exactly what to do next.
Inside South Australia's State Emergency Operations Centre, a disturbing call is coming in from a service station. A woman in her 80s has fallen and smashed her head on the ground. Another customer is by her side.
So if you call out to this lady, does she respond in any way?
No, not in any way. I'm not sure if she's with us anymore, to be honest.
Intensive Care Paramedic Hannah is now on the way, lights and sirens. She'll provide specialised backup to crews who are just ahead of her.
My big concerns for someone who's fallen and hit their head with excessive amounts of bleeding is that she's given herself a traumatic head injury. This could be anything from bleeding inside the brain to skull fractures. She could be having a heart attack. She could be having a stroke. She could be in a cardiac arrhythmia that's caused her to collapse today. And if this is the case, these are life-threatening and she needs our help right away.
Suddenly, the call is upgraded to a priority 1.
We've just got an update that the patient is now in cardiac arrest. This is as serious as it gets.
Cardiac arrests can cause sudden death within a few minutes. Less than 10% of cardiac arrest victims outside of a hospital survive. To add to the pressure, this is Hannah's first day in her new job after just being promoted.
This is my first shift as an intensive care paramedic, and this job is as big as it gets. So to say that my mind is absolutely spinning is an understatement.
I definitely think that staying home with the kids is far harder than coming to work.
I take my hat off to any parent that can stay at home with the kids. Like, total respect.
Working mums Sally and Olivia are on shift and enjoying the break from family life.
Dad, I just don't know how you do it. I don't know how you juggle your 5 children and full-time work. I'd be in the nut house.
Being a single mum's hard. Sometimes I feel like I'm a hot mess, but you do what you have to do and it just works.
All your cards, bro. Seriously. No, they're not the same.
Kimura, Coco, Hallie and Denzel are all at home, while 25-year-old Kobe lives on his own. It's a busy household, but Sally's always juggled family life with full-time work.
Being a paramedic is my second career. My first career was in retail, but I always wanted to be in a job where I was helping people. So in my 30s, I decided, right, let's get myself off to uni. At that stage, I had 3 children, and it was really hard, but I'd always told my kids, there's nothing you cannot do.
That was 15 years ago, and Sally's never looked back.
She's a really great role model as a powerful woman and a reminder of the things that you can achieve.
I don't think I'm a Wonder Woman. I'm just someone that's making a positive contribution to society, bringing up my kids the best I can. It's just me doing my job.
Copy, Prody 2.
The quiet start to the day comes to a sudden end when there's a call for help for a little boy who could be in big trouble.
We're going to a 3-year-old who's hit their head on the playground in his shopping centre and is vomiting.
Okay. I actually really enjoy doing the kid jobs, but if they're acutely unwell, if it's a chaotic scene and I can see that mum's really struggling, if the child dies from their injuries, that tears me apart.
Hello, how are you? My name's Olivia, this is Sally. This is your little boy? Yes. Hello, Massimo, is it?
Massimo was enjoying a play date with his grandma Katerina when the accident happened. Mum Anna has now raced to be by her little boy's side.
Can you tell me what happened?
So he was on the playground, came off, but I was sitting down so I didn't see him, and he said, oh, my head's sore, I hit my head.
Okay.
I waited for about 2 minutes, and then he didn't hold his neck up and he started to want to go to sleep. And then I came here and he vomited a big vomit.
Okay. Would he normally be this flat this time of day? Never. The fact that Massimo's lying listless in a trolley, I immediately start thinking, oh, crap. Like, what does this mean? He should not be behaving this way. And that this alteration in his behaviour is because he has a concussion or a head injury. So I'm immediately concerned.
SA Ambulance, tell me exactly what's happened.
Well, a car just slammed straight into a light pole, like it had a seizure or something at the wheel.
And how old is the driver?
He's young. He's 18, 19.
A terrified witness is on the line to the Emergency Operations Centre. It's a call that's every parent's worst nightmare.
Is he conscious at the moment?
He's just coming round, yes.
Just reassure him that help has been arranged.
Help's here, Luke. It's okay, mate.
After 19 years in the green uniform, solo responder Dan has seen too much teenage tragedy on the road.
Unfortunately, the carnage that we see is all too real. Knowing that my eldest is going to get his licence later this year, when I go to vehicle accidents, it definitely makes me think about how he's going to go on the roads.
A detailed assessment required relatively quickly here to make sure this young fella's going to be okay.
The first paramedic crew to reach the patient has immediately called for backup. Dan will now take the lead in what is rapidly becoming a life-threatening case.
Howdy, how are you?
Hi. So we've got Luke here. How old are you, Luke? 17-year-old Luke.
Yep.
He's feeling a little bit faint.
Yep.
And then doesn't remember what happened, but witnesses say he's hit the pole at about 80.
Okay.
And the fireys say when they got here, he's a bit like in and out of it.
Sure.
Quite distressed.
Yeah.
Lost consciousness at one point.
You actually started fitting?
Okay.
Yep.
Yep. Luke, have you had seizures before? Okay.
So Luke has stopped seizing, but he's going in and out of consciousness. Forefront of my mind is he could seize again. And if Luke starts seizing while we're still in the car, his airway could very much be compromised.
If you're able to get some really quick assessment of Obs and see what injuries we've got, because we're going to want to get him out fairly quickly.
Yeah. Where's your pain worst at the moment? Neck and back.
There's always potential in a huge vehicle accident for spinal damage. If we don't take him out safely, we could make those injuries worse. So right now, I'm a little bit stuck between a rock and a hard place. I want Luke out of this car quickly, but I want Luke out of this car safely. And I've got only seconds to make these decisions so we can get this job done.
Keep your head still, mate. You're doing well.
Just listen carefully. I'm going to tell you how to do resuscitation, okay? Pump the chest hard and fast, twice per second, 5 centimetres deep. So start compressions.
At the Emergency Operations Centre, a call taker is giving life-saving CPR instructions. An elderly woman is now in cardiac arrest after dramatically collapsing at a service station.
Let the chest come all the way up between pumps. We're going to do this 600 times until help takes over, all right? So 1, 2, 3, 4. So keep going with those compressions until crews take over.
It's newly promoted Hannah's first day as an intensive care paramedic. She's on her way to the critically ill patient. The first paramedic crew to arrive has taken over CPR, and they're desperately trying to restart the patient's heart.
All right, MCCD.
All right, so charge and check, compressions continue. Everybody else stand clear. Charging. Clear. Very comfortable rhythm. Shocking. Back in the chest, please.
As I arrive on scene, we have the patient lying on her back. There's lots of blood all over the floor and over her face. We have 4 paramedics providing CPR, defibrillating the patient and ventilating her with oxygen.
No pulse. No pulse.
Hannah is now taking over the CPR, hoping the chest compressions can help keep the blood flowing and keep the woman alive. No wallet has been found. Nothing to identify her.
So we've got 1 minute to the next charge and check.
All right.
A charge and check is the warning that the defibrillator is about to send electric shocks through the patient. To be safe, everyone at the scene has to be hands off.
All right, guys, for the next charge and check, we're going to lean her forward.
Compressions continue. Everybody else stand clear.
Yep.
Charging.
All right, guys.
Hands off.
I'm safe.
Shocking rhythm. Shocking.
All right, lean her forward, lean her forward. All right, guys, straight under the arm over her left shoulder. All right, down we go. All right, there we go.
To free up the team for other life-saving tasks, they decide to use the thumper, a mechanical device that takes over CPR in tight situations.
All right.
Okay.
Yeah. There's already a lot of pressure at a cardiac arrest to do the absolute best you can. But what does make it harder is that this is somebody's mother, sister, friend, and they are relying on you to save their loved one's life.
So charge and check. Compressions continue. Everybody else stand clear.
Yep.
Charging.
I'm safe.
Shocking. No pulse. No pulse.
More crucial minutes go by. 3 shocks from the defibrillator has still not started the woman's heart. The situation is now critical. The longer her heart is not pumping blood, the greater the chance of brain damage.
All right, I've got a good line.
30 seconds to the next charge and check.
Yeah. The patient is still in cardiac arrest. What this means is that her heart is not beating and she's not breathing on her own. Essentially, it means that she is clinically dead.
Charge and check. Compressions continue. Everybody else stand clear.
Yep.
Charging.
I'm assuming there's normally like a more energetic kid than this? Yeah. Okay.
The lady said that you can be sick in this bag, okay, sweetheart?
3-year-old Massimo is listless and vomiting following a knock to the head while playing. Sally and Olivia are worried the little boy may have a serious head injury.
He's got a swelling here like a lump.
Yep.
Katerina was looking after her grandson when the accident happened. She then phoned his mum Anna, who raced to be by his side.
I'm just going to have a look behind your head. So I'm going to touch and you let me know if there's pain, okay? No? What about here? Although I'm not noticing any signs of severe injury outside of his head, it's really important we take him up to the hospital because of this alteration in his behaviour, which could be the sign of a concussion. With kids, we need to be cautious when it comes to their assessment after hitting their heads. There's definitely a potential for him to deteriorate. There we go, buddy. So my concern is the fact that he's flat and he's tired after the event. Worst case scenario, the vomiting is due to some small swelling in the brain. And on the way to hospital, the worst thing that could happen was be that he has a seizure.
I know Katerina and Anna want reassurance that he's going to be okay, but right now we can't give them that, and I don't want to lie to them.
All right, little man. Just a couple little bumps is where you get you into the back, okay?
He's confused, but he's talking and he's complaining of some symptoms, so we're just going to make sure we get him out safely. However, he's been witnessed by the fireys to have a seizure post-incident, so there's a potential for deterioration as well.
Back at teenager Luke's car crash, intensive care paramedic Dan is facing a dilemma.
What was the blood pressure?
It was 170 over 120.
All right, high.
Dan wants to get Luke out of the wreckage immediately before he has any more seizures. But the horrific impact of the crash could have caused internal bleeding or spinal injuries that demands a slow, meticulous extraction.
Luke, what we're going to do is just cut the car and take you out on our board so that you don't have to move your head and your neck.
All right. Keep your head still, mate.
As the fireys start cutting metal to gain access to the patient, Luke's distressed mother arrives at the disturbing scene.
When I saw the vehicle, I started to panic. I could feel my heart like jumping out of my chest. It's the worst thing that a parent can actually see. I just can't imagine life without my child. It just wouldn't be survivable.
Seconds to the next charging check.
Yep.
Time is running out for intensive care paramedic Hannah and the team. Despite several attempts to shock their patient back to life, there is no heartbeat.
There's no blood circulating through the body whatsoever and no blood getting to the brain. This is as critical as it gets.
Security cameras show the moment that the elderly woman collapses. No identification was found, but a set of keys and some great detective work has led police to the patient's home. Paramedics now know the woman fighting for her life is 81-year-old Monica.
So charging check, compressions continue, everybody else stand clear, charging.
I'm safe. Non-shockable. Yep.
We notice a change in rhythm. So it's important for us to check for a pulse to see if her heart is beating on its own.
We got pulses.
Okay, so we've got a new patient, guys.
We find a pulse. This is pretty incredible, and this is everything we work for and what we hope for. Now we need to make sure that we can maintain it.
All right, so we're getting a blood pressure. We've got spontaneous rests. We'll go adrenaline infusion just in case she arrests again.
We really are sitting on the precipice with Monica. It's very likely that the patient will slip back into a cardiac arrest.
All right, so we're going to go for an immediate tube. Equipment has been tested. We've got ETCO2.
To keep Monica's airways open, Hannah needs to intubate. It is one of the most challenging procedures intensive care paramedics perform in the field.
It's going to be Jess and I doing the tube, so critical communication only. I'm going to get Elise to time you over 30 seconds. Okay?
All right, can I have the bougie, please? All right, we have the bougie through. Can I have the tube?
Performing an intubation outside of hospital is a critical procedure. We need to insert the tube through her mouth and into her airways.
All right, we're in, bougie out.
It's really important that it's done correctly and quickly.
All right, we're taking out the blade. Can you put 5 mil, cup up? And then we'll reconnect and do some ventilations, okay? We've got rise and fall. Can you check the radial pulse there?
Yep. So we've got a strong radial this side and blood pressure sitting around 300 now.
Okay, perfect. And then also it'd be worthwhile putting some closed suction tubing on just because of the blood, and then we'll get out of here.
Despite the fact that Monica is now breathing and her heart is beating, time is still of the essence in this case.
All right, ready? 1, 2, 3.
She's still extremely unwell, and the priority has now changed to rapid extrication to hospital.
15 minutes ETA.
No worries, thanks.
And this means lights and sirens because every second counts.
What hurts the most?
Just my entire lower neck.
Your lower neck area?
Shooting pain down the spine.
Yeah.
17-year-old Luke has slammed his car into a light pole. Intensive Care Paramedic Dan is under pressure to get the teenager out. Mum Lindy can only watch on, helplessly.
So just for everybody, he has actual neck pain. Yep. Okay, so let's all be slow and steady.
Yeah. At this stage, we don't know whether he's suffered some level of spinal damage. So my plan of action is to get Luke out of the car in a controlled fashion, or we could make those injuries worse.
All right, everybody's ready. So on 3, we'll start to slowly pivot. 1, 2, 3. Good man, Luke. Good man. Good man.
Good job.
There you go. You're on. Got his head.
Yep. Right, let's everyone reset there.
Ready in every position? Yep. Okay, so on the count of 3, a slow move up. 1, 2, 3. Happy? Great call. All right, well done.
With Luke safely out of the car, now we need to manage Luke's physical pain, but the emotional anxiety must be overwhelming.
You're doing well, mate.
So my job also is to keep him as calm as possible so that we can get him out of here and make the worst day of his life slightly better.
Dan can now start investigating exactly how much damage Luke has done to himself in the crash.
Squeeze my hands for me, mate. Wiggle your toes. Does it feel normal when I touch your feet?
I feel that one, but I can't really feel the other one.
What about this arm?
It's just tingling.
All the way?
Sort of.
And it's still your neck that's hurting? Yeah.
Luke tells me that he's got neck pain, he's got back pain, and he's got tingling down his arms. Unfortunately, he's ticked a lot of boxes that is a huge red flag for potential spinal damage.
The sats are still good, heart rate still good electrically, adrenaline infusion's still running.
Critically ill Monica is just hanging on to life as the paramedic team race to hospital. The 81-year-old has survived a cardiac arrest, and intensive care paramedic Hannah is constantly checking her vital signs.
So is all the bleeding coming from here?
I think so.
So I wonder if the cause of the arrest was the head strike or the head strike is just secondary.
We can see that she's sustained a wound to the front of her head, which is bleeding heavily. Our concerns are that she's not just bleeding on the outside, but also on the inside.
Yeah, it's quite intense. I can see it flowing. I'm just going to put quite a reasonable amount of pressure there.
A team of doctors are waiting to take Monica into the resuscitation room. At the end of her first day as an intensive care paramedic, Hannah is still fearful for her patient's future.
All right, guys.
We've done absolutely everything we can for Monica. We've given her as much chance of survival as possible. But unfortunately, the odds are stacked against her.
How's your dating life going? I know you've always got a new story for me, so hit me with one.
It's a quiet start to the day for intensive care paramedic Aaron and his work partner and good mate, Laura.
Like, it's hard work. When you go out on a first date, you want to look good. You want to be nice.
I don't remember what that's like.
What, being nice?
That and going on a first date. Aaron's love life and mine is definitely a contrast. I'm in like this happy, committed relationship, but he's still trying to figure out, I think, what he wants.
One date a couple months ago, just to catch up for a coffee with a girl.
Yeah.
After 10 minutes of talking about just random stuff, she's like, oh, you're a lot smarter than you look. I was like, that's kind of like a backhanded compliment.
Yeah, it's definitely a compliment.
But then I went home and I was like, why do I look dumb?
Why do I look dumb? Yeah.
Single life is not tough. I love it. Sitting at home, you've got your own space. But the dating life is tough. Like, yeah, it's absolutely really tough.
Prospect 50. Roger, mate. So we're going priority 2 to 17-year-old female with a head knock following contest, broken nose, but she is conscious. So it sounds like she was playing women's AFL.
Love it. Loves the young girls getting out there.
Yeah.
They must have gone in hard.
Women's Australian rules football teams are becoming increasingly popular, but frightening injuries are also on the rise.
It's a nasty knock. We've got to get there quickly because if she has got a concussion or a worst case scenario, she's having a bleed from the head knock like that kid that had last weekend.
Yeah.
And he ended up passing away. Tragedy.
Head knocks and broken noses, not fun.
The dangers of contact sport are not lost on Aaron, who used to play semi-professional ice hockey.
During one of the games, I broke my nose and my face is just leaking blood, split open, and then it kind of hit me. I was like, oh, this really hurts. I've got my head in my hands, tears rolling down my face. My headache is uncontrollably painful. It's 10 out of 10.
Look at it now, better than ever.
If you say so. I'm just going to pull up here. I'm such a massive fan of female footy. It was never really an option when I was younger, and I think if it was, I definitely would have got into it. And I mean, I can now, but I think I'm a little bit scared.
Cheers. Hey, how you going?
17-year-old Pam. She's collided with one of her own teammates, believe it or not. She's gone down onto her knees, so there's been no loss of consciousness, but she's got the obvious fractured nose.
When we walk in, I'm not being mean, but Pam looks so awful. She's got all this blood running down her face and the poor thing's upset and she's in pain, and I just really feel for her.
The first thing that came to my mind is, does Pam have a concussion? She's had a really hard hit to the nose, and broken bones hurt. Hits to the head really ache. And I, for one, know that I had pain for weeks when I broke my nose. So I'm feeling what Pam's feeling.
Can you feel any bumps? I had a look before, but sometimes things take a little while.
I think here feels swollen.
Anna and her son Massimo are on their way to hospital. The 3-year-old hit his head while on a play date with his grandma, and Olivia and Sally are worried he may have a serious head injury.
A knock to the head can certainly lead to things like seizures. Although we're not getting any signs of that right now, we need to keep a close eye on him. On the play equipment, do you remember what you hit your head on?
I was playing under, and then they got away from that, and then I hit it under.
But as we're making our way up to the hospital, Massimo's becoming a little bit more interactive, which is reassuring, but he can definitely get worse. Now, who's this?
That's Momo.
Momo. Do you want me to put a bandage on Momo?
Yeah.
So we can pretend he hurt himself?
Yeah.
All right.
I can hear Olivia bandaging up Momo, having a little bit of a chuckle inside. We have all of these tools in the back of the ambulance and medications, but sometimes all a 3-year-old needs is just for you to get down on their level and look after their teddy bear.
There you go. How's that?
Put him with Stinky.
Put him with Stinky.
Because Stinky crawled and hurt his arm.
Oh, and then he vomited.
And
then his mum got really scared.
No, Stinky can't open his mouth because he's a teddy.
Oh, smart child. I'm going with the banter, trying to make Massimo feel comfortable. And there I am being hung out to dry by a 3-year-old.
While Massimo's smarts are clearly intact, he still needs to see a doctor to clear him of a dangerous head injury.
Why we stop?
So we're at the hospital now.
All right, little man.
Now that we've arrived at hospital, I am absolutely relieved that Massimo's vital signs remain stable throughout the journey. Hopefully, after some monitoring, Massimo gets to go home with his mum, Nonna, Momo and Stinky and head back to the playground, fingers crossed. You did so good.
Yeah.
That hurts really bad.
Okay.
Aaron and Laura have just arrived at a local women's footy match where their teenage patient is in shock and extreme pain.
It's isolated pain to the nose,
Yep.
which is just across the T.
Yeah,
I've
sure.
palpated her entire face and everything else feels intact. No C-spine pain, but she's saying all of her limbs feel really heavy and she's still got 8 out of 10 pain.
Okay.
All right, Pam, I'm going to leave you with these guys, okay?
Thank you. Is this Mum?
Yeah.
And Dad. And Dad.
Oh.
Your little girl goes in hard.
William and Carla are understandably worried. It was just 2 weeks ago that the 17-year-old suffered an on-field concussion. So this time, they feared the worst.
I saw her collapsing with someone from her own team. I knew something is not right, and I started to get worried because she was not standing up. They took her out of the field, and that's when I saw her face was covered in blood, and she was crying, scared, shaking. She was in shock. It was scary.
Can you just open your eyes nice and wide for me? Perfect. No blurry vision.
It's a little bit blurry.
Yeah. I'll get you to look to the left and right of you, just nice and slowly, but if your neck hurts, I just want you to stop. And now the other way.
Hey, Dad.
Hey, baby.
I'm sorry.
Oh, are you sorry? You don't have to be
I know
sorry.
you don't want me to get concussions and everything.
Yeah, but you do play and you enjoy it, so these things happen. Pamela is a super girl. I'm so proud of her. Everything she does it well. She is the sweetest girl, amazingly friendly, but when playing football, she just transforms into this beast, killing machine. You know, she just loves it. It's in her blood.
You're right, Pam. Bones heal.
No year 12 formals or anything?
Yes, it's
Oh, sorry! Oh, no! I was joking!
You'll be fine for next.
You'll be fine.
I may have made a little mistake asking her if there was any formal coming up. Of course, it's 2 weeks away. Thinking back to 10 years ago when I was 17 and putting myself in her shoes, I'm like, oh no, the poor thing.
Go the gullies!
Oh, we're winning!
You are winning.
Pam is now being taken to the nearby Women's and Children's Hospital. The 17-year-old will have scans of her head and neck to work out whether this wounded footballer will need surgery before her all-important formal.
Carla, I'll get you to jump in the back.
Bye, Dad.
Bye, baby. I'll meet you there. I'm worried about so many things. The possibility of her having another concussion. She's got so many plans for her future. And the possibility of having a brain injury, it scares me.
It's really hard to breathe.
It's hard to breathe.
It's tight.
Your chest is tight.
17-year-old Luke is about to be taken to hospital to investigate possible spinal damage or head injuries after a horror crash into a light pole.
Is my mum here?
She's here.
Yes. She knows you're doing all right.
But what happened?
You've crashed the car a bit, mate. Yeah.
I just walked that far.
Did you?
Luke's speech is still slurred and he has no memory of the accident.
You guys are just too good. I always wanted to be an ambulance person.
Really?
Yeah.
Ah.
Not very good with my biology, though.
You never know. Maybe one day.
You guys save lives, and that's cool.
Oh, plenty of people come to paramedics after having done something else first, so it's never too late.
Guess I'll see you soon.
Yeah.
All right, so if you're happy, I'm happy to go.
So it sounds like all Luke's recent adventures with the paramedics led to him thinking that being in my chair working as a paramedic would be far more preferable than being on the stretcher as a patient.
Luke.
Yeah.
Still awake, mate? What we're going to do is just pop a little bit of plastic on your nose in case we have to give you even more pain relief.
No green whistle today.
No green whistle, no.
Yeah, we got a line in.
You know the green whistle. No, impressive, mate.
We all have our jobs at these scenes, and I feel like Luke has an amazing job to do as well. He's in physical pain, he's had the trauma of the accident. This is not how he imagined his day was going to go, and yet at this moment, he's listening to us and he's staying as calm as he possibly can. It's an extremely brave effort.
I'll give you a size 15 shoes to Mum. There you go.
At this stage, we don't know whether Luke's suffered another concussion, whether his seizures will re-emerge at some point, or whether he does have some level of spinal damage.
You're doing well, mate.
My nose hurts. My head hurts.
You'll have a bit of a headache.
Aaron and Laura's patient Pam is on her way to hospital with her mum Carla. The 17-year-old was playing footy when she collided with a teammate, resulting in a badly broken nose and possible concussion.
So it's going to heal back.
It'll heal great, yeah.
Crooked.
No.
The Year 12 student has her school formal in 2 weeks and is nervous about how she might look.
Nah, she'll be right.
Remember what I said before? It's
and
a
also,
2-week
makeup
thing.
artists these days, they can cover anything.
Oh, wait, I forgot to take my makeup off for my game because I was on a date.
Oh!
Hey, how'd you meet this guy you went on a date with?
Oh, we met at a party.
Yeah, nice.
He's different from any other guy I've met.
Oh.
Yeah, he like...
Some risky words you're saying there.
Exactly. The first date, he was like, let's go to Botanic. And I was like, oh, okay. Because Botanic is just notorious for just hooking up.
What's Botanic?
Botanic Gardens. Yeah.
Oh!
Like, yeah, we can have a picnic. And he made us lunch. He made me a sandwich.
That is a green flag.
I know, and he's so sweet.
The green whistle's a really unique form of pain relief we use. It's highly effective, really simple, but it also, in kids or younger adults, we find it lets their deepest, darkest secrets out. Pam's a great example of this. She's on cloud 9. It's moments like this where you're like, hey, she's not in any pain anymore. She's laughing, joking. This must be working. We're doing something right.
As long as my teeth don't get knocked out, everything else is fine.
I play ice hockey and I had my teeth knocked out.
Really? Like, how many of them?
Front 4, please.
So that was like a proper knockout.
Don't you wear a mouth guard?
Mum said the same thing to me. She's like, where's your mouth guard?
Aaron and Laura have done their job of taking Pam's mind off her injuries.
We're just about to pull up.
But the 17-year-old won't be able to relax until doctors confirm just how much damage was done in the on-field collision.
Is it still bleeding?
Just a tiny bit.
Alrighty, shall we? I'm really hoping that Pam's only in the hospital for a short period of time. They can rule out any head injury. They can make sure she doesn't need any surgery for her nose and she can be back playing footy in no time. And I really hope that their swelling and the bruising goes down before formal.
Come through.
What hurts the most?
A shooting pain down the spine.
Teenager Luke ploughed into a light pole and had to be cut out of his wrecked car. His mum Lindy was terrified her only child wouldn't survive the crash.
Okay, Luke, sir. Just remember to take it easy, just around here a little bit.
Yeah.
You are actually a good driver, so you're going to be fine. Okay?
Luckily for Lindy, Luke walked out of hospital 5 days later.
I feel very lucky to be alive. Yeah, definitely for a few years of my mum's life, she kind of turned me into a little bubble wrap child when I got out of the hospital.
I only have one child. So throughout life, I've said to Luke, you need to be careful about what you do because I don't have any spares.
Tests showed no sign of a seizure. Specialists believe dehydration caused Luke to feel faint and pass out behind the wheel.
I just wanted to be an ambulance person. You guys saved lives and that's cool.
Oh.
As for the future, Luke is now certain about his destiny.
I'm going to become a paramedic. That's what I'm passionate about, and that's, all these people saving my butt. It's time to save someone else's butt.
I'm just going to have a look behind your head. So I'm going to touch and you let me know if there's pain, okay?
3-year-old Massimo gave everyone a scare when he hit his head after falling at a playground.
Would he normally be this flat this time of day? Never.
His grandma, Katerina, called for an ambulance after her precious grandson started vomiting and became strangely quiet. At hospital, doctors monitored Massimo for signs of brain swelling. A concussion was confirmed, but later that night, the little guy was allowed home to rest and recover with Stinky. Two weeks ago, fearless footballer Pam collided with a teammate and broke her nose.
Can you just open your eyes nice and wide for me?
Aaron and Laura were worried she may have also suffered a concussion. But all the 17-year-old could think about was how she would look at her school formal.
So it's gonna heal back.
It'll heal great, yeah.
Crooked.
No.
Dad, you ready?
Oh my God! Look at you! Oh, jeez! Oh, jeez! Look at you! Show me around.
Yes.
So gorgeous! Oh no!
Pam was assessed at hospital and cleared of concussion. Her fractured nose needs to be straightened, but for now, that can wait.
I've been looking forward to this moment my whole life, so now that it's finally here, I'm feeling a bit nervous. My nose is still very tender. I don't know if other people can see it if it's broken, but it's really painful still. I don't want to touch it.
You can't barely notice. You
No.
look so beautiful.
Thank you.
Despite the pain and doctor's orders not to play for 6 weeks, Pam is definitely not giving up on her footy passion.
We just talked to her and say, Pamela, I'm concerned about you. Why don't you play chess or badminton or something else? She said, no way, Dad. I can't wait to go back to the pitch and play football again. And I said, whoa, good on you.
I'm so excited.
It's your night, baby. It's your night. Have fun. Enjoy it.
Her nose, I am not gonna lie, doesn't look straight, but nothing that makeup can't fix. She will be fine.
Bye.
Stand clear.
Yep.
Charging. Hands off.
I'm safe.
Shocking.
5 weeks ago, 81-year-old Monica collapsed and died at a service station.
Can we check for a pulse?
We got pulses.
Okay, so we've got a new patient, guys.
On the first day in her new role as an intensive care paramedic, Hannah shocked Monica back to life, but held little hope for her survival.
Given the fact that we see so much life and death every day at work, it really does remind me that the most important thing is to just spend time with friends and family and live every day as best you can, because if this job has taught me anything, it's that life is very unpredictable.
Hello.
Hello.
Hi.
fancy meeting you here.
Oh, can I have a hug?
Yes, certainly.
Thank you so much.
Thank you very much for saving my life.
How are you feeling?
I feel terrific.
You look amazing.
As if nothing's wrong with me.
Oh my goodness.
Tests showed that a heart attack caused Monica's cardiac arrest, but given her age, doctors have ruled out major surgery, opting instead for ongoing medication.
Mum's a miracle. We can't believe it at all that she has survived. To see the state she was in for days on life support, then not recognising us, not being able to squeeze our hand, and then since then, she has just improved in leaps and bounds.
Well, I can see why you survived, Monica, because you've got a very strong spirit.
Well, my time wasn't up yet.
Absolutely not.
I'm a firm believer, if your time's up, it's up. My plans is that I can go back to being normal again and be independent and enjoy the rest of my life. So I'm very thankful that I am still here.
Oh, no.
It was absolutely beautiful meeting Hannah. She's a lovely person. You know, you've got to have the highest respect for the paramedics. I'm just blown away with what they managed to do. They have just done a phenomenal job and you can't thank them enough.